Hi, I'm Christy. I want to talk to you today specifically about physical therapy. I should preface it by saying that I am not a medical professional. This is not intended to be any kind of medical advice. It is for informational purposes only. The big thing with physical therapy is that it focuses on gross motor skills. I was told in kids this generally means anything with the legs. The research that I found defined it as treatment is needed when it's hard to move or do everyday tasks. It can help you move better and potentially help relieve pain. And the other big thing is that it makes tasks and activities easier to perform. Some of these tasks and activities can include walking, going up and down stairs, transitioning in and out of a bed or a chair, and pedaling a bike. The goal of PT is generally to improve things. It can be to improve movement or flexibility, strength, coordination, balance, and sometimes even endurance. Occasionally, they can even teach you how to do things at home so that you don't have to attend the clinic every time. The key that I found is that the work is done consistently, that there's a good attitude and good effort done every time. Occasionally, a plateau is going to be hit, or maybe even some regression. And the key here is to talk to the therapist and to make sure that they understand what's going on and they'll be able to guide the family through the whole process. Therapy sessions that I've observed typically last about an hour. It's generally about 50 minutes of actual therapy time and then a few minutes on either side to talk to the therapist. If the patient isn't able to last that long, they might consider doing shorter sessions. Usually PT lasts for a minimum of 6 weeks if there's been an injury that you're trying to recover from or something like that. Other times there's a long list of goals that are there that need to be worked on, and so they'll work on one or two at a time and work their way through the goals, and so it may take years if the list is long. A lot of times people wonder what the difference is between therapy at school and therapy in a private clinic. And it's basically that there are two different models of therapy that are being used. In school, they use an educational model where they're focused on anything that pertains to the school environment and the school day. So for PT, it's can you get up and down stairs? Can you open and close doors? Can you transition between any different kinds of surfaces that you're walking on? Those kinds of issues. If you can do all of that, then you're good to go from an educational perspective. From a medical perspective, they're concerned about all of those things, but they can be a little bit broader. So one of the examples I use is that my older son learned how to pedal a bike in private therapy, but they weren't interested in that in educational therapy because it didn't impact his school day. Our experience with PT was very positive. We're still reaping the benefits of the years of therapy that we did. And I hope that your experience is also positive. I would love to hear what your experience has been like. Feel free to leave me a comment below. As you continue on this journey, I hope that you can join me and say that life is good and there is never a dull moment.